Carolyn, when do you want me to come on?
Charysse, I'll have you come on after we've gone through
That's
our slides.
right. Okay, great.
Absolutely.
I want to welcome everyone to our year in review meeting here today. We're starting to let people in, so it'll just be a minute before we get underway. I'm going to go ahead and get started. Thank you all for joining us here today. I don't know that in January when we started this year, we all thought we would be here, but here we are. After 12 months of really exciting, engaging, and wide-ranging conversations among this community. So we are doing two things on this call today. First, we're going to do a quick review of everything that we've gone through, reminding people of the highlights and resources that are still out there for you. And then we've brought back three of our most popular and engaging panelists from the year to give us new insights about what they've been doing, answer some more questions, and really sort of round out where we were for the year with some of our people who were most helpful to you all throughout the work that you've done. So if we can go to the next slide. The first section here is the recap, which is I will be here, obviously. I'm Charysse Nunez from Hadaway Communications, joined by some of the behind the scenes team on this, Caroline Jaros, who keeps this thing running like clockwork every other week and has for the entire year, and then Estelle Willey from Rockefeller, whose idea and brainchild this whole project was. And our speakers who'll be joining us, we have Charysse Nunez, who is with the AdCouncil. You know, they've been doing fantastic work on a whole host of topics all year long, and she's going to share with us some of their most recent work. as well as Dr. Atul Nakashi, who joined us back in July and is here again to talk to us more about how to fight misinformation and really continue to fight that good fight and share how to keep good information front and center for people as you're communicating, especially with all of the new information you have to deal with. And then Kevin Parent from the Ottawa Department of Public Health, who holds the unique distinction of being the most followed public health social media channels in North America, and his unique and engaging take on how they've worked throughout this pandemic to help keep people safe and keep them well informed. So again, we're going to start with where we started, how this all came to be, some tips and tricks for how to build that community of practice as you're working with your local communities, and then some real insights about the latest twists in pandemic communication. Feels like every week we think we're getting on top of it, or maybe even a little ahead of it, and then life throws us one of the many curveballs that we get as this pandemic continues.
Hi, everyone. So just a quick background. This started off really as a response at the very height of the COVID-19 pandemic. You guys remember back in 2020, really a group of bipartisan governors wanted to come together because they wanted to purchase COVID-19 tests in bulk. And from that original convening, we decided to start meeting once a week. And many of the conversations within those groups tended to talk about a few key themes. One, of course, was about vaccines, especially when vaccines became available in December. One was about reopening schools safely. And the third topic of conversation was about communications. How do you communicate during an ever-evolving situation? And really the challenges that it posed for both public health practitioners, people in the governor's office, and everyone on the front lines. So that's how it started. And it really, when we first brought the Communications Action Network together, it was a really small group, just from the governor's offices. But well, you can go to the next slide, Caroline. But what we realized is this was actually a big concern for a lot more people than just the original group of the core comms leads at the governor's offices. So what we did was expanded it out and really create a community of practice for communicators all over the country who are really struggling to find what to communicate, how to communicate, and what was the most effective ways to do so. And you know, we also realized that there was just a lack of capacity, a lack of time, a lack of money to really do your own research or make those creative assets. So we brought in experts from all over the country to share with us those insights, share with us these resources, and really expose everyone to research campaigns and insights that could really help empower you and inform you when you're communicating about COVID-19 to your audiences. So in 2021, what started off as a group of 27 people in January of 2021 has grown to over 950 people from over 300 organizations across the world, not just the US. We also heard from 45 different voices from all ages and backgrounds, and met 21 times this year. Super exciting. And who you are, just a glimpse of the different types of organizations out here. I won't name everyone, but just to share the diversity of people on this call and in our community. I know we're meeting remotely every other week, but it truly just shows the interest and need for communications during this pandemic. So with that, I'll turn it over to Caroline.
Actually, I'm going to be doing this part, and you know,
Sorry.
as we were planning each webinar, we were really looking at the news, talking to lots of you, hearing where your concerns or gaps were, and really responding in the moment. And what we realized as we started to look back was there were 5 really big themes of everything that we talked about. You know, misinformation and narratives, how to combat them, how to set the narrative and really drive the communications that you wanted to see. Back to school, which was not a typical September back to school. You know, from January on, we were always trying to get kids back to school, whether it was understanding concerns, responding to concerns, communicating about what schools were doing. Equity in all its various forms, many different audiences that we looked at and talked about throughout the year. The use of tech, how could technology make communications simpler, better, clearer, more interesting? And then finally, the bread and butter of motivating messages with, you know, we have been doing a tracking study roughly every other month, testing different messages linked to what was happening, you know, first starting with testing, then talking about vaccine uptake, going back to testing when there was a testing shortage, and coming back to vaccines and back to school mandates and things like that. So as you can see, you know, we started really with that high level of how to use communication, how to combat misinformation, and then got very granular. We had a clinical perspective of how she answered questions from a variety of different kinds of patients in her practice, including many who were unhoused and recent immigrants to the country who were not well versed in our medical system here. And then talking to the Latino conversation community with Dr. Gilberto Lopez and the unique cartoon-driven work that they had done with some really creative videos and other materials for Latino audiences. If you can go to the next slide. Then we talked with the hard to reach, you know, people who were skeptical, people who were on the more conservative side of the political spectrum. And then Kevin, that was Kevin's first appearance in May, talking about all his work with the Public Health Department in Ottawa. And then going on to really talking about a hyper-local strategy with Falls Church, Virginia, and how they got their teachers and students to comply with mandates. If you can go, as we continued through the summer, we started to look again, really focusing on our back to school, guidance for engaging communities, messaging, fighting misinformation, and then looking at case studies on how schools had done it well. And then in the last few months, we went back to vaccines, really focusing on driving vaccine uptake with additional messaging guidance on using a chat box, and really how to deeply focus on equity in our last session with our partner Pink Cornrows. And so we've sort of run the gamut, and yet as we see, we sort of keep going around in circles and needing to refresh messages on different topics, revisit things and make sure people are aware of all the good work that's been done and know how to resource it. So wanted to remind you of everything we've done and know that lots of this has been sent back out or is available on the Rockefeller website. If you missed any or all of some of these, there's lots of ways to hear what we've done before and get your hands on those resources.
Alrighty, I'm so excited to talk about a little bit, you know, how we built these webinars and what our thought process was behind building them, and also some of the tips that we learned along the way that we'd love to give back to you and to help you build your own community around whatever you're passionate or you know, the topic of conversation. So Nina, if you'll go to the next one, thank you. Yeah, so our guiding principles for this, our first one was address real needs, not assumptions. We as communicators have our own way of doing things, but we want to make sure we were talking to the right people and making sure we were getting the most beneficial resources in their hands. Pair research with practice. We wanted to make sure all of our research had a human element and someone could speak about the real-time, real-world application. Many of our webinars followed the pattern of research, strategy, and on-the-ground perspectives. For example, in October, the Johns Hopkins Vaccine Access Center joined us to talk about their Vax chat bot named Vera, and our panel had 4 people on it, including everyone from the AI designer and who were working on the back end to a woman using the Vax chat bot in Baltimore and giving us that, you know, on the ground perspective. Here's how it's going. Here's the questions I'm hearing, the conversation, and it was really beneficial to get that feedback also to the people that were, you know, designing the bot and the technology around it as well. Share diversity of perspectives. We had 45 speakers throughout the year who just ranging in age, background, location, religious background, political background, you name it. And this gave us a really well-rounded series of voices and perspectives that we all just learned so much from. And lastly, keep it candid, share successes and struggles. Some of our best sessions were people getting really, really vulnerable and sharing the tough times that they were dealing with, the times they considered giving up, and the moments of hope that kept them going. And that was really important for us to hear firsthand from people. We recently had a college student come on and talk about what it was like being a college student during the pandemic, and the communications that she was getting. And a week earlier, we had heard from a communications professional at a college. So we were getting both of those perspectives, hearing from both of them. What's the struggle of talking to students, and for students, what's the struggle of understanding the COVID precautions of their school? Nina, if you'll move to the next one. Thank you. And so we've learned so much over this past year, and we want to give this information back to you, as I said. First, let the community guide and make sure you lead. We always had an ear to the ground. We were always asking people and crowdsourcing topics and ideas of conversation, but we also looked for new research, and we sought out new campaigns and tried to find the out-of-the-box speakers to keep the sessions interesting. Respect their time. We know our community are some of the busiest people in the world. And one of the best comments we got one time was, wow, that was a lot of information packed into an hour. And so we kept the sessions to an hour, the same time every other week, to build that consistency and make sure that we're sharing as much information and helping people use that 1 hour on Wednesday the best as we can. Prioritizing action. For us, it was all about, getting takeaways that people could use immediately and sharing things that helped people take further action, or just, our constant kind of call for getting involved with the organizations and the speakers that were on our calls. People sharing other ways to get involved in the chat, in our community. It was really great to see how many people were ready to take that action and to do something when our speakers shared it with them. Make time for real talk. We valued the opportunity to workshop with people. I think that's such an important part of communications, and to hear the experiences that they were having and provide insights and recommendations that informed our research and a lot of the research of our speakers as well, to hear what people were dealing with. And additionally, we encouraged everyone to share their stories and experiences in the chat as well. It was wonderful to see so many people agreeing with others, sharing their common frustrations, sometimes giving an opposing view, and making real connections in that chat box. It was great to see. And then lastly was share accessible resources. So we asked all of our speakers to provide tangible or really actionable resources and takeaways and guidance that our audience could use. And we know that a lot of people, cost is a barrier to a lot of these assets and to doing a lot of the research that our speakers were doing. And so we want to make sure the things that we were sharing were free, accessible, available, and easy to use, as well as being consistent in providing a recap email after all the sessions with the recording, any of the slides and resources shared, and then also information on other initiatives and news relevant to our community. And so that is just a little bit about what we've been up to in this past year in our 21 webinars, and true to why we're here in our guiding principle of use our time efficiently and give you information. As Carrie mentioned, we've invited 3 speakers today, and the first is Charysse Nunez, who back in February, her colleague Catherine Chow came and shared their vaccine insights, and so she's here today to give us their latest December insights briefing. So I will turn it over to you, Charysse.
Thank you, Carolyn, and thank you for having me here on behalf of the AdCouncil. Always a pleasure to share the rich insights and learning concerning vaccination uptake, but more importantly, where my passion lies is representing the voice of the American people wherever they sit along the adoption continuum. So looking forward to sharing with you our latest insight and information. So on the first slide, I always like to set the stage with just an overview of, actually we can transition to the next slide. An overview of the landscape, and this is leveraging our wonderful CDC reported data, where we see that roughly 60% of the total population now fully vaccinated. And I do think it's important to note, I'm a big advocate for making sure that we evaluate it versus benchmarks, even though this is certainly a very new and nuanced virus. But when we look at this relative to the flu shot, it exceeds flu shot levels by 10 percentage points. And that's based on reported data from 2019 to 2020. And we also see that over 80% of the adult population now has been inoculated with at least one dose. So certainly it's important to pause and acknowledge that this is undoubtedly a significant behavior change in less than a year in an environment that has been highly dynamic and where we're still learning. So certainly a Herculean effort and an accomplishment to be very pleased with. When we look on the next slide, and this is looking at our internal AdCouncil self-reported data, and this is among the adult population, and we've been tracking very closely uptake across various demographics, and specifically demographics that have been disproportionately impacted, and where we've leaned in to understand concerns, questions, and provide relevant and timely information to build vaccine confidence. So what you see here is clearly with the post-June and with the Delta surge, we have seen consistent upward trends across demographics. Both the Black and Hispanic communities now have close to 75 or 80% vaccinated with at least one dose. And while uptake among those residing in rural communities has increased, we do see that their rates lag that of the general population. And we have leaned in heavily with this community to better understand the concerns, the dynamic, and to provide information to help build confidence for that population. When we began the process in December 2020, we were certainly looking at a vastly different landscape. So here you see, at that time, we knew we had 50% of the population that was undecided with a wait and see mindset. And now we have 8% of the adult population who remains undecided. So again, tremendous shift in less than a year with a new virus and a novel therapeutic treatment. What's also important when we look at this slide is that the percent of the population that is resistant to vaccination has declined considerably from 20% to 14%, which demonstrates that in time, as people get the information they need and through personal experience, confidence increases. When we look more closely at across various demographics and where some of the opportunities remain, the opportunity to build vaccine confidence still is greatest among the younger population, specifically the age group within the 25 to 39 range. And we do know that the younger audience is more inclined to feel and believe that they are at lower risk for severe illness. And they do deem themselves to be in better health. And many may be less engaged in preventative healthcare practices. So those are core drivers for the opportunity among this group. We've also noted that this segment, there is a heightened level of concern with some of the unknown potential long-term effects related to fertility. And given that this is the age range where they're, in that childbearing mindset, that's another area where we've been seeking to provide information that's available to alleviate those concerns. As I previously mentioned, when we look at data from an urbanicity standpoint, again, there's a greater opportunity at this point with those residing in rural communities. And we've done a lot of predictive analytics, and we know that the largest determinant of vaccination is experience with the virus, experience or having family and friends that have been impacted. And so we know in communities where they have been less impacted because they're less densely populated, that is a driver. So As mentioned, we've been doing a great deal of work to have conversations, engage ourselves with this community, understand where the barriers and the opportunities are, and engage with them to elevate the fact that there are benefits. The benefits to the vaccination outweigh the potential risk. We've also done a lot of work to understand the decision-making process, and I think this is very important because people process information at different phases in different stages. And there is a discrete decision-making process that people are making, and it involves a number of different factors. First, they're considering their overall health. So there are those that may be immunocompromised, and that may cause them to lean in one direction related to getting vaccinated. Then you have those that perceive themselves to be in overall good health, and that may put them more in the open but uncertain or skeptical frame of mind. For those that are pregnant and nursing. As mentioned, there is just the engagement with preventative healthcare practices, whether they have been engaged historically with other vaccinations, particularly the flu vaccine. We also know that the perception of the COVID risk is a huge factor in the decision-making process. So personal experience with COVID, whether they've had COVID and have recovered, has there been an increase in outbreak in the community, and assessing the benefits versus the risks. So what are the unknowns risk related to the vaccine versus the known risk of vaccination, or known benefits of vaccination. Then you look at the benefits. So there's always, as I somewhat alluded to, the benefit risk ratio. So what are the benefits of vaccination, the protection benefits of vaccinating yourself as well as your loved ones? And then we know that restrictions and requirements do also play into getting vaccinated, can serve as a benefit because you'll be potentially be able to, engage in more societal events. And then the evidence, many are seeking evidence. What are the positive outcomes from those that have already been vaccinated, particularly in their circle? And so all of the work that we've done, at least to date, has now really led to the fact that personal conversations, family and friends, is really the dominant way that people are engaging and getting more confident and comfortable with getting vaccinated. And then validators, of course, there's always those trusted professionals, and really trusted professionals as it relates to healthcare professionals that and local community leaders that can add value and credential and credibility to the vaccine. So we've looked at that just as a framework. We've looked at those things to kind of understand where we can best penetrate and intervene with relevant messaging and information that is known about vaccination. We've also, as I think many of the colleagues that have already mentioned here, this has been a very much an evolving landscape. There's a myriad of news and information that people are exposed to and hearing day to day. Things are evolving, things are changing, whether it be related to the virus or related to new news concerning the vaccine. So we have been doing work to understand what are those narratives that have the greatest challenge, the greatest opportunity to challenge vaccine confidence. And there are really 4 core areas that we've learned based on our analysis. There's narratives that may lean into institutional distrust, narratives that may challenge the perception of efficacy. There are also narratives and misinformation regarding the vaccine safety. And then more recently, narratives around the necessity. And you can see what I have here is that everything here there is a combination of narratives and misinformation, narratives that actually are fact-based, or narratives that may be part truth, or narratives that are disinformation and not true at all. So we've evaluated these to kind of understand where are the awareness levels, and then to what extent are they actually driving an impact in challenging vaccination intent. And on the next slide, this is where you see the mapping, okay? So it's a quadrant mapping, which maps the overall awareness of the narrative of the misinformation and the extent to which it breeds doubts about the benefit of vaccination. And what you see is that in the upper right quadrant, the primary areas of focus where there's high awareness and a high degree of doubt center on institutional distrust and questions about the vaccine durability. And that really relates to what we know now around the need for boosters. In the center, we also see areas related to safety, particularly as it relates to teens and children, and the unknowns related to pregnancy and infertility. So we've been doing this on a quarterly basis and then leveraging this information again to optimize the information that we have on our website, as well as to optimize messaging and communication through all of our PSAs. We've also evaluated a range, of course, we've evolved quite significantly since December in terms of the PSA, the messaging, the communications that we've had available as we've navigated the target audiences, as well as navigating the new information in the marketplace. And more recently, we've honed in to evaluate a variety of various creative executions with distinct messages. And what we found is that personal stories, conversations with family and close friends are most likely to impact and drive consideration. So one of the creative executions was really around a survivor's testimony, somebody that actually had a very severe experience with COVID and shared her personal story and journey. And this was very effective in driving people to consider. We also had another execution, which we launched recently, which was families that are having conversations with their family members, close friends having conversations, one member being vaccinated, another still on the fence or skeptical, and really having heart-to-heart conversations that are not divisive, but that are caring and concerning and reinforcing that we are in this together. And that also proved to be very effective. So these are the two areas that we have been leaning in to most recently from a communication standpoint. So looking ahead, with the reality of breakthrough cases, and now, as we've all learned, coming off of the Thanksgiving holiday with Omicron on our heels, you can turn to the next slide. We've been evaluating the potential intent related to boosters. And this is looking at it among the population that's vaccinated. And what we're seeing is that approximately 50% of those vaccinated cite that they will definitely get the booster. And again, this was done pre-Omicron. So we're now in the process of getting that learning within the next week. We should have it to see if there's any increase in intent given the potential of Omicron in potentially taking root in the US. Prayerfully, it does not. And then what you see here is that younger adults, similar with vaccination, are less inclined to consider the booster. So this is something that we're continuing to stay abreast of as new information continues to come to the forefront regarding the need for boosters. And then when we look at parents, and you can transition to the next slide, we see that about a third of parents remain undecided about vaccinating their children. Certainly parents of younger children are more cautious. So you see it's closer to about 40% for children that are under 12. But to date, you have about 60% of the population indicating that they've already vaccinated with children 12 and up, have either vaccinated their children, or close to 70% say they would definitely will. And then you have 45% saying that they definitely will vaccinate their young children under 12. When we look at the areas of most concern, it should come as no surprise. Of course, parents are most concerned about safety. Safety is key and paramount. So the primary concerns for parents as it relates to vaccination, and this is the younger children, is the unknown long-term effects in children, the potential serious side effects post-vaccination, and this notion of possible of effects on fertility in the future is also prevalent among parents. And this is specifically for those for children under 12. We've done some messaging to understand to the extent, and this just for reference, this is not yet vetted with the CDC, but we wanted to understand, and we looked at several different categories. So we looked at messaging that really honed in on the protection for kids, messaging that leaned into what we know about the clinical trials and pediatric recommendations, protecting the vulnerable, the risk of COVID-19 for children, and information provided around how the product is developed with a lower dose to ensure safety for children. And by and large, parents are, as you would expect, concerned about protecting the children. That is the most compelling reason to consider vaccination. And so you see those three here at the top, and the way the question was broached is, what is the single most compelling reason as to why you would consider vaccinations for your child or your children age 5 to 11? And so protection is key. And so that is what we're leaning to in terms of our messaging, followed by protecting the vulnerable in your family and in your lives. Okay. So in terms of communication considerations that we've been leaning into, it's really elevating the voices of those that have been impacted with COVID and may have been part of that wait and see segment, and leading with relevant personal stories, those of survivors, healthcare workers, family, and friends. And then continue to emphasizing the known benefits of protection, highlighting the known risk of COVID-19 infection broadly and with children, and the protective benefits of vaccination. And as far as new creative, unfortunately, I don't have all of that to share today, but we can certainly provide a link so that you can see some of the latest work that we have done focused on young adults, parents. We are continuing to lead in with fact-based information with relevant new news related to the vaccine protections and as it relates to variants. And then also continuing our work with the rural community. So these are our 4 core pillars as we close out the year. And lastly, which we do not have any information or PSA available for it yet, but there are conversations around what the next step would look like from a booster campaign standpoint. And with that, I'll turn it back over to Carolyn.
Thank you so much. It's so great to see all that research. Thank you, thank you, thank you. All righty, so next up we have Dr. Atul Nakazi, who is joining us from LA. And let me just pull up your slides real quick.
Thank you, Caroline. Pleasure to be here.
All righty. Take it
All right.
away.
Thank you, Caroline. Good to see Estelle and the team and fellow colleagues here on the call as well. Just going to give a brief overview in a couple minutes of This Is Our Shot, and then our lessons learned from our clinical on-the-ground experiences on messaging guidance and insights, such as that from AdCouncil, De Beaumont Foundation, and various organizations that have helped us develop messaging guidance and then deploy it as healthcare heroes on the ground with our patients in communities. And so my name is Dr. Nakasi. I'm co-founder for This Is Our Shot, a campaign to elevate the voices of healthcare heroes to provide that accurate information and to combat misinformation. I'm a primary care doctor in Compton and Watts in South Los Angeles, and also a policy advisor for the LA County Department of Health Services. We can move to the next slide. So our program in specific, this coalition of over 25,000 heroes, we had 4 major pillars. Just to give a brief overview here. The first pillar was social listening. What were communities saying? What were CBOs saying? What were individuals, communities, patients saying on the ground? So we were very fortunate to work with 3 partners Project Vector with the Public Good Projects, Virality Project based out of Stanford and NYU and several academic institutions, and the CDC. So they would provide our coalition of healthcare workers data on when misinformation was moving from fringe to mainstream as it was trending to the mainstream discourse, largely in digital spaces. So that was the first pillar of the program, is the social listening. We would then develop counter messaging to that misinformation, counter messaging that was evidence-based, scientific, and accurate. And so that would take the form of both preemptive cognitive inoculation to get ahead of the misinformation, and then reactive debunking as well to counter and react to that misinformation. So we had two methods, both preemptive and reactive, in that counter messaging. And then we would take that messaging and those digital assets and those messaging guidance, and then train our healthcare heroes, pharmacists, nurses, physicians, medical trainees, and students on that messaging guidance. We'd recruit and train them on that, and then deploy them in CBO conversations, in Facebook Live conversations, Instagram, on Twitter, across both digital and community spaces. And so that's just an overview of how the kind of program worked, from social listening to message development to hero training and recruitment to deployment of that messaging guidance to our communities and our patients. We can move to the next slide. So this is just to give very concrete examples of how this worked. This is under the key takeaways you see there on the slide. That's data from Stanford's Virality Project in specific. And so we had the COVID-19 State of Vaccine Confidence Insights Report from CDC. We had Project Vector. We had a Virality Project. We would get weekly messaging data from Virality Project. One example is where that arrow is saying information voids have opened up on two topics. One, the risk of myocarditis for vaccinated teens, and then the next on the necessity of vaccines for people who have previously had COVID-19. So when we got those alerts every Monday afternoon, Tuesday morning, we would then turn around messaging with our executive team of healthcare workers into an email blast that went out. That's the This Is Our Shot email blast on the latter half of the slide, that would go out the same week within about 72 hours of this messaging social listening data that was being inputted to our team. So you could see in that output that we would release every week to about our entire listserv of healthcare workers, you can see the June 11th key message is vaccination is recommended even if you're all already had COVID-19. And then we included some sample social media posts. For example, why get vaccinated even if you've had COVID-19? ? Well, because natural immunity is variable and may not last. Get vaccinated for free at, and then website. And then another sample media social post was, I had COVID-19. I am a doctor. I chose to get vaccinated because I'm not taking chances with the unknowns of natural immunity. And so we would provide these created messages and sample social media posts to make it as easy as possible for healthcare workers to respond to misinformation with accurate counter messaging. So one of the best practices here is what to say. What we learn here is what to say depends on what is being said. And so that's a specific kind of tool and asset we created through the campaign. We can move to the next slide. In terms of the hero training that occurred, so we had the listening, then we had the message development, and then we would train heroes on these messaging assets. So we created very simple messaging tools. This is an example of one of them. It's just one page, but it has the top 5 highest concerns from our patients based on focus group data and polling data on what patients and communities were concerned with about the vaccine. And so we created very simple messaging tools. We created simple training videos. They were under 5 minutes long, 3 to 5 minutes, given the short attention spans on the digital spaces, oftentimes on relevant trending topics. These are freely available on our website, which we can link to in the chat. This is our shot.info. And then we also had live training workshops. So I just came from one with the California Department of Public Health. We did a 1-hour live training workshop on training healthcare workers how to use this messaging guidance in the real world, in their conversations in clinics and communities. So we had 3 different training apparatuses: simple tools, training videos, freely recorded, easily accessible online, and then live training workshops with facilitators as well. And so that's kind of how our training program looked like on this messaging guidance. And then we can move to the next slide here. And so ultimately here, the impact that resulted from the entire campaign over the last year was we were able to activate 25,000 trusted messengers. This is an example of the campaign we started. That was the vaccine selfie campaign 1 year ago during the first EUA of Pfizer around mid-December now in 2020, and in getting healthcare heroes to post and validate the vaccination experience to their friends, their family members, and colleagues, and to disseminate clear, simple evidence through those social media posts. Next slide. And so this is just a summary view of that impact before we go into the lesson learned. So we had about 15 organizers, 57 partner organizations trained through those live trainings, 2,200 healthcare heroes. And then we had about 25,000 who posted digitally accurate information. And this ended up resulting in about 1.3 billion digital impressions. It ended up becoming the nation's largest healthcare worker-driven campaign to provide accurate information digitally. And so this was kind of a summary of the impact. And then finally, really to dive into the lessons learned in the next set of slides. So there are 4 big best practices and lessons we learned out of this campaign over the last year that we feel is applicable to public health communicators, healthcare workers, individuals working in Department of Public Health at the local, state, federal levels, on really disseminating effectively this information that at least we have surfaced through our experience in this campaign. So lesson 1 we learned is making the messaging tools as easy as possible. So one of our mottos on the campaign was the 80-20 rule. How can 20% of the content or language convey 80% of the information? And so, there are a lot of concerns, of course, with the vaccine. And we've all seen the FAQs. I mean, I have 100 FAQs that I've read through. All of us have that are, 20, 30, 40, 50 pages long. Our biggest challenge was we had very busy healthcare professionals. So how can we give them messaging guidance in easily digestible ways? So we just took, the top concerns, and that covered 80% of the concerns based on the polling data, which were on safety, side effects, effectiveness, the speed of the vaccine, and questions patients had, and turned it into a digestible 1-pager. And this is one example of feedback we got was from a user that said, used tips from the TIOS messaging guide twice yesterday. Once for a patient and once for a friend to reassure them and help them decide to get vaccinated. Good stuff. And so what we realized is if we create a 10-page guide, 0 people will use it. But if we create a 1-page guide, hundreds of people will use it. And so it was like, how can we make things useful? And simplicity was our best friend in that exercise. That was one main lesson. The second main lesson we learned, which is on the same slide, actually, if we could go back. The second main lesson we learned is that the science communication is very hard. I mean, look at Omicron. Yesterday, I had a patient tell me, doctor, tell me about Omicron. What should I be worried about? Well, as of an hour ago, Omicron's in California now, here in San Francisco in the United States. The data is changing by the hour in some cases, if not by days and weeks. And so it's very hard to communicate with evolving science, which is the nature of the process. So what we found helpful was live trainings were very helpful for us. We partnered with the California Department of Public Health in this method called the 353 method, which we developed and innovated on. And we essentially, it was just a method on how to get to yes, using motivational interviewing and empathetic approach and 5 key messages. And you could see the data here. This is data. We've trained now 2,200 healthcare workers across the state of California. Before the training, about 48%, that first bar graph, were very confident or confident. How confident are you in your ability to talk to patients and clients about the vaccine? About 48% before the training. after the training, we saw a 40 percentage point absolute increase to nearly 88% confidence, either very confident or confident in having the toughest of conversations on the COVID-19 vaccine. And so this was after just a 45-minute training on these principles, the 3-5-3 method, really embedded in motivational interviewing and those high-level top 5 messages I mentioned briefly. And so these live trainings were extremely effective for us. 45-minute workshops that our executive team members would lead, and we saw dramatic increases in confidence for people to have these conversations, especially now with those remaining unvaccinated. We can move to the next slide here. And then just to wrap up, the last couple lessons we learned from on the ground as healthcare workers were, mandates appear to be working from anecdotally what we're hearing, what we're seeing from our patients. So for example, these are encounters I've had in the real world that I'll just read real carefully, quickly here. I had a middle-aged patient of mine who had lots of cardiovascular risk factors. He already had a stroke. He was paralyzed on one side of his body from uncontrolled diabetes and high blood pressure and high cholesterol for 10 to 20 years. A man in my community in Compton, who I see regularly, and a patient of mine for several years now. And he just told me on the phone 2 weeks ago, he's still unvaccinated now, a year into the vaccine being available. And I had the conversation for probably the 4th time with him now. And he finally said, this is what he said to me just 2 weeks ago. He said, I know I'll need to get it eventually, doctor. I might surprise you next visit. And it warmed my heart that he himself too was also coming around slowly in that journey of trust over, several months and over that year. And so maybe it'll be a holiday Christmas surprise, perhaps next time I talk to him. I don't know yet, but that's just an example of realizing that it's going to be needed to continue to engage in a lot of day-to-day life activities. Another patient of mine, a young adult who works at LAX airport, said, I need it for work by December, doctor. Can you schedule me at clinic? And then a third actually individual who's an employee in my clinic, not my patient, but an employee who works in our clinic in South LA, said this is what he said to me, said, if they mandate it, I'll get it. If they don't, I don't really have a reason to. And as a young man in his 20s, 30s at most in my clinic who I see, who works in the clinic I work in, and those were his words to me, and he's vaccinated now. With the mandate in our health system, we were stagnant at about 70, 75%, and we are now at 93% because of the mandate. So they are working from the sentiments expressed from patients to us as healthcare providers in the real world to help nudge in the direction of vaccination. And then the 4th and final lesson here, just to share, is that even so, there are still remaining patients unvaccinated that are highly skeptical, and we're still having difficult conversations with. I'll just give a real world example. One of my own patients, a 50-year-old woman in Compton Watts community I take care of, I've been her doctor for a couple years, and she is one of my highest risk patients. She has an autoimmune condition. She is on powerful immunosuppression, mycophenolate and prednisone, 2 powerful drugs as those clinically may be aware of that are suppressing her immune system. And she should be should have had 3 vaccine doses right off the bat as an immunocompromised patient, and she is not even on her first one. And I realized in hindsight that I needed to acknowledge further her personal agency, her choice. And it was I spent more than an hour in conversation on the vaccine, and in some ways still have not gotten to building that, moving that direction towards yes, because I was pushing too hard. And I realized that towards the end of the conversation. So unfortunately, she remains unvaccinated as one of my most vulnerable patients. But I share that story to say that even as a passionate provider who wants to vaccinate people, sometimes the right approach is actually to just, it's to step back a little bit. It's to acknowledge their agency, their choice in their decision. And so what we used in the campaign, one mantra of ours was, give the facts, acknowledge their personal choice, empower their agency, don't push too hard or force the choice, because it can often lead to backlash. It did, I felt in my particular case, where I felt I took some steps backwards now after pushing a bit too hard in that patient case, and only for the best intentions, but even so, that approach did not lead to the desired outcome. And so this is an example of another real world post we had from an individual in our campaign. So it's actually because of your reels and posts that helped me move forward with my decision to get vaccinated. I sincerely appreciate your fact-based approach that mitigates the fear mongering. So we hear that a lot in our campaign and from our patients. There is a proportion of the population that is just, they want the facts. They just want the facts because they feel like the whole pandemic has been fear mongering to them. And they feel like there's lots of agendas, whether it's in the media and the community, from family members, from doctors, from medical institutions. There's a lot of rightful mistrust that's, embedded in experience, in life experience our patients have had. And so just giving that, I often call it a journey of trust. It's like marching down a football field. You might start at your own 5-yard line, but eventually you might get to the 10, 25, the halfway line. And maybe in 3 months, 6 months, a year, or a couple years, you're within 10 yards of the end zone, marching down. And so it's that journey of trust done in a very kind of objective, fact-based way, acknowledging their agency that we're seeing is working for some of our most highly skeptical patients at this time too. So another lesson we've learned, on the ground as clinicians. And then we can move to the last slide, I believe here. So just in summary here, lessons we've learned from on the ground through This Is Our Shot campaign: keep tools super simple, especially for very busy, healthcare providers, public health officials, leaders, social services staff. Live training can be very helpful. Mandates have been helping, giving the facts, that acknowledging the agency and personal choice has been very helpful for our yet to be remaining vaccinated patients. And then just for some resources to wrap up. So these tools I mentioned are freely available, the messaging tool, the videos at our website, www.thisisourshot.info. In the resources tab, just click Become an Advocate and you'll see these resources there and the videos. And then we have a partnership with the California Department of Public Health. That website is the second one there, easyIZ.org/COVID/30 conversations. It has our live training videos pre-recorded from all our conversations. And so you could get a sense that they're freely available and they can be shared with staff members and public health workers, social services workers, healthcare workers on how to have these very difficult populations. And we have them by demographic, by community, by concern. And so we have one on how to approach our rural communities, how to approach our communities of color, how to approach pregnant individuals in the right culturally and linguistically appropriate ways that are meeting our patients' needs where they are. We have training videos on how to do that freely available. And then finally, my contact information is below. Happy to be in touch with anyone to share more knowledge or best practices that we've surfaced. Thank you so much for your time.
Thank you so much, Dr. Nakazi. It's so great to see you again and appreciate you being here. I hope that patient comes back and is vaccinated. I think that's the best Christmas gift this year. Thank you. And last but certainly not least, Kevin Parent is here from Ottawa Public Health. So I will, let's see, I should be able to spotlight you real quick. But Kevin, if you're there, you're up. Hi, Kevin, can you hear us?
Yes, there we go. It briefly booted me out, but I'm back.
No worries. Yes, we totally have time for you. We're so excited to hear from you. Tell us how things have been going in the most popular social media site in North America.
That is very kind of you. Thank you. So yes, for those who are not aware, my name is Kevin Parent. I am a program and project management officer with Ottawa Public Health. way up here in the frozen north, where for those of us using imperial measurement, it's about 26 degrees outside right now. So it's wonderful and tropical and great. And yes, Ottawa Public Health is the most followed local public health account in North America on Twitter. It's something we are very proud of. It has been, I mean, I feel like 4 years have passed, Carolyn, since we met way back in the late winter, early spring, and all kinds of wonderful things have happened. So overall, I mean, our strategy hasn't really changed. You know, pre-COVID, we had a very audience-first approach to social media. We read all the comments, we read all the replies. We are massive believers in plain language. We are massive believers in being human and empathetic. Our entire social media strategy really is summarized in the notions of you know, you always hear people talk about social media as if it's this separate world, right? Everybody's heard somebody say that, oh, that's on social media, but this is the real world. Well, no, social media is the real world. It's just another way that we talk to each other. And also, that was a seamless transition. By the way, this is Joey, and he's here. So, and then the other side of it is that we approach all of our online communications as we would our offline face-to-face communications. It really is just that simple adage of, you know, if you could actually be face-to-face with a member of our community and give them, you know, the messaging that you need to give them, what would you actually say? So, my goodness, he's adorable, I know. You know, what would you actually say and what would you tell them? So, you know, we very often have conversations in our comments and replies. We tend to approach it just from that notion, you know, like traditional government comms, large scale comms, it's approached as broadcasting, right? It's that classic agrarian word, you know, you take your seed, you cast it as broadly as you can about a field and you hope something lands. Well, traditional government comms is done that way too, right? It is putting a ton of work into crafting all the message and then you send it out and you move on to the next. Well, with us, I mean, you know, yes, we do put an incredible amount of work into crafting our messages, but we often say that the bulk of our work doesn't actually start until the message goes out. Because yes, as much as it's a broadcast when it goes out, by the way, guess where Joey is, totally fine. As much as it's a broadcast when it goes out, the moment that one member of the community, you know, one follower, you know, answers you, replies to you, puts a comment on your post, suddenly now your massive broadcast has become an intimate dialogue. You actually have an opportunity to have one-on-one back and forth with members of the community. It's the beautiful thing about social media. You know, it shatters our notion of distance. That's a shaker toy, by the way. It makes a ton of noise. It's a great time. So it shatters our concept of distance, right? Like one of the things that I love to say, because it's just me and I'm a huge nerd, in 1839, there was this article written by a gentleman who had ridden the train for the first time in his entire life. And when he described the experience, he described it as the annihilation of space and time. Like, really think about that for a moment, right? In terms of the impact of technology, like places, other cities, other countries that were so far away that in 1839, you never would have visited them in your lifetime. All of a sudden now they're like 2 days away. You know, so social media does that same thing. It takes that concept of distance and just brings it right there. So we can have, you know, intimate one-on-one interactions with people all over our community, all over the country, and very often internationally. In terms of, you know, lessons learned over the last little bit, always work with Ryan Reynolds if you can. I mean, it is still the most successful thing we've ever put out on any of our accounts. And if I can actually multitask enough to put a link in here, anyone who hasn't seen it, shameless self-promotion of that lovely little video that we did way back when, which we are, you know, it's still going. One of the things that has been so wonderful about that video is, other than the fact that it was a wonderful thank you to the audience, the concept of Bruce is still there. It's still talked about quite regularly. We actually just had an interaction with Ryan Reynolds on Twitter the other day where he said he's looking forward to the next Super Bowl. But overall, it has just been, it's about being open, being real, being human. Some of the moments that I was immensely proud of with us, back when we first had, you know, the vaccines first became available to the wide population, and we had an online booking system in the province of Ontario. We have provinces, you guys have states, it's a thing. And like anything else with technology, you know, there were issues with it, right? It would go down and then there would be glitches and whatnot. And on probably 5 different occasions that I can think of, Ottawa Public Health put out communications just apologizing, telling people, hey, we really know that it's been frustrating and we wish it could have been better. We are very sorry about this, and et cetera. And, as a government comms person, when is the last time you ever heard an official account apologize to somebody or take open accountability for something? It's such a standout moment that, the audience is so receptive to it because they know you mean it. They know you're being genuine with them, and they know you're being empathetic with them. I mean, pick your crisis communications theorist. In the States, you guys probably have Peter Sandman, who you'd quote a lot. Up here in Canada, Dr. Josh Greenberg is wonderful. The late and incredible John Rainford. These people all talk to you about the importance of using empathy and transparency and honesty in your communications. And we follow that to the letter. As much as we're known for being this account that is humorous from time to time, everything we do is data driven. Everything we do is evidence based. And probably I'd say the biggest lesson that we've learned, to do like a reflective of 2021, is prepare for the fact that you're going to write like 12 years worth of content in 10 months. Welcome to public health. And B, probably the best thing we've done is really just remember that everything we communicate, it's about just focusing on the people. So much of social media is approached from a perspective of data, right? Like we've all seen the presentations from this company, that company, whatever, that wants to do all these analytics for you, and everything is approached from a perspective of data streams and trends of data, et cetera, et cetera, et cetera. Everything we do is focused on people. We recognize that it doesn't matter what you're talking about. I don't care if we're here having a conversation about social media. I don't care if we want to talk about the peer-reviewed, published in proper journal evidence that we use to guide our comms, any of it. When you boil it down, it comes down to people, right? Find me any study out there. At the end of the day, it started with a human being asked a question, and all the data points came from that. So our entire comm strategy, the last while especially, has just focused on that. We are people, we are speaking to people, and it is that simple. I know that seems like a giant oversimplification, and it has nothing to do with the fact that the little version of me just made maybe one of the biggest messes I've ever seen, so I got briefly distracted, but it's totally fine. But yeah, I think that's our big takeaway from the last year, is just be open, be human, be real. Your audience will see it, they will recognize it for what it is, and they will respect you for it, and they will be exceptionally receptive to it as well. And I think that's probably the best way I can summarize the last year, other than the fact that I think my hairline used to be up here at the start of COVID, but that's a whole other thing.
Thank you. And I think it was so wonderful to hear you talk about how you extended that empathy and that, human caring to your staff as well, who were behind the social media and were getting a lot of that response and sometimes that vitriol, and that you encourage them to take their mental health days and to take care of themselves. So great to hear. Thank you. And thank you to Joey for his appearance as well. Well, thank you all so much. We are a little over time, going against one of my guiding principles, but just a few quick thank yous to Estelle and the entire Rockefeller team for all of their support, to my fellow Hadaway colleagues and MCs, and to all of our speakers, and to all of you. It's been so wonderful to know that there's so many people out there who want to be better communicators and that want to focus on equity, find the new technology, and find the best ways to communicate with each other. And it'll be the thing that's most surprised me over the past 2 years now has definitely just been how many people are here for this work and taking it so seriously. So thank you. We will share the session, the recording, the slides, all of the resources shared, to look out for our last recap email of the year. And as we mentioned, all of the past recordings and resources will also be up on the Rockefeller website soon. So thank you all so much. I really appreciate it, and have a great rest of your Wednesday, a wonderful holiday, and we'll see you in 2022. Thank you, everyone.
Thank you.